What are the most common causes of hair loss in men and women?
So the most common cause overall of hair loss is always going to be genetics. Another word for hair loss is androgenetic alopecia. So this can come from either side of the family. It can come from a man or a woman. And since you're not a clone of those family members with hair loss, the year it starts, the speed, the severity, and how bad you'll end up before the age of 100 can't be predicted. There's a lot of risk factors that are also involved with genetic hair loss. The big one is age. Every decade that we age, our risks do go up by at least 10% or more. But there's also a lot of hormonal factors. People that are on testosterone, it can accelerate your hair loss. Women with PCOS, when women begin going through their menopausal years, that also creates a shift in their hormones that can trigger genetic hair loss or make it worse. And there are others like thyroid. If your thyroid is balanced on medicine, that's not an issue. But if your thyroid is imbalanced, that can certainly cause a lot of hair loss. The other most common cause of hair loss, which is still less than genetic hair loss, is called telogen effluvium. That is a fancy word for stress-induced shedding. What happens is, and there's a laundry list of causes, once there is a stressor inside the body, as a reaction, your hair seeds begin to push out the hair shafts. Those hair shafts go on vacation for a while, and until the stressor is found and removed, and oftentimes it's just time that is required to heal, those hairs will safely come back. The biggest mistake that I see in my practice is that everyone assumes their hair loss is due to stress when it's actually genetic hair loss. Having said that, you can actually have genetic hair loss and then have periods throughout life with stress-induced shedding. So that can make your genetic hair loss picture look worse. Very common causes of stress-induced shedding would be nutritional imbalances, whether it's crash dieting, a lot of these new weight loss drugs that cause massive weight loss in a short amount of time. There's also issues if you have inflammation in the body, if you undergo anesthesia, hospitalizations, illnesses, the list goes on and on. The big ones that I do see in my office are usually more nutritional issues. Low iron, low ferritin, vitamin D, B12. These are just some of the labs that we always need to test to ensure that they're optimal for your hair health. A very common one, as I mentioned before, is thyroid. A lot of people will not have symptoms, or they will have symptoms but don't know why they feel the way they do. And then when we check their thyroid, we find out that there is an imbalance in their thyroid function. Once we can get on the proper medication, get the labs back to normal, those hairs will recover. So thyroid imbalance would be more under the list of stress-induced shedding.